LSD, a drug with once high hopes by medical researchers to a criminalized and illegal drug. Although the use of LSD has shown to be therapeutically effective for treating various disorders, it can also cause harm to users with specific mental health disorders. So, how exactly does the use of LSD affect psychotic disorders such as schizophrenia and bipolar disorder? What are the risks of using LSD? How have we evolved today with the information that we know? Lysergic acid diethylamide, also known as LSD or acid, was first synthesized by Swiss chemist Albert Hofmann in 1938. 5 years later, Hofmann was the first to experience the hallucinogenic effects of LSD after accidentally ingesting the drug. A few days after his initial contact with LSD, he then tried a much higher dose. The hallucinogenic effects began to set in as Hofmann was riding home on his bicycle from work, experiencing the world's first acid trip. The work from Hofmann opened up the field of hallucinogenic research during the following years. As Hofmann noted the mood-changing effects of LSD, research on psychedelics grew rather quickly in the United States during the 1940s in regards to medicinal uses. Psychiatrists quickly grew interested in the potential use of LSD for psychotherapy purposes, such as treating trauma. Under the brand name Delicid, LSD was marketed by Sandoz Laboratories in the late 1940s and was used for psychotherapy in several psychiatry practices across the United States and Europe. LSD was studied to look at behavioral and personality changes, as well as the remission of psychiatric symptoms and psychotic disorders, such as schizophrenia. During this time, LSD was also used to treat anxiety and depression, especially in terminal cancer patients. LSD was used to treat alcohol addiction as well. Dr. Humphrey Osmond used psychotherapy to treat addiction in the 1950s, and his research was cutting edge. He had actually coined the term psychedelic. During this period of research, LSD was used as a model of psychosis in order to learn more about psychotic disorders, as LSD could replicate the symptoms of these disorders. Some psychiatrists believed that they should use LSD in order to fully understand what their patients were feeling. Throughout the 1950s to early 1960s, thousands of scientific papers were published on the research of LSD. LSD had also been prescribed to more than 40,000 psychiatric patients. However, some researchers believed that LSD did not perform well in clinical trials. They also believed that the drug could easily become a substance of abuse and was dangerous, as LSD could cause intense hallucinations and trigger psychosis. Now stepping back to the 1940s. The CIA ran studies on human behavior and quickly became interested in the use of LSD as a potential incapacitating agent. MKUltra was an illegal experimentation program designed to study the effects of psychedelics in interrogation. During these studies, participants were given LSD without their consent and experienced extreme hallucinogenic side effects. The studies by the CIA eventually failed to LSD being an unreliable truth drug and were unethical. Fast forward to the 1960s, recreational use of LSD increased greatly in the United States. However, widespread fear of LSD grew rampant across America due to counterculture movements. This movement scared society and led to legal troubles. Psychologist and psychedelic celebrity Timothy Leary was a huge psychedelic advocate in the 1960s and became a well-known counterculture figure. Richard Nixon referred to him as the most dangerous man in America. Anti-war protests broke out in America by counterculture activists who spread the message of peace, love, and drugs. The activists and LSD users mainly consisted of white, middle-class teenagers to young adults. LSD was then seen as a threat to the Vietnam War effort, which eventually led to its illegalization. In 1967, LSD was prohibited in the United States. In 1970, LSD was placed as a Schedule I drug along with other psychedelics, and the war on drugs began. As a result of the events that occurred in the 1960s, research on LSD decreased drastically and all interest in LSD was lost. Research on LSD has taken decades to become of interest again. There has been no LSD studies conducted on humans in the past 40 years until recently. There was a recent study in LSD-assisted psychotherapy on patients with life-threatening diseases such as cancer. The results of this study showed a reduction in anxiety and an increase in the quality of life with no adverse effects or psychiatric complications. However, not many patients were involved in the study. Different and non-evidence-based therapies have been used in psychedelic-assisted therapy trials, which makes comparisons between control versus placebo studies difficult. So, what exactly are the effects of using LSD? The effects of LSD may include delusions, hallucinations, distortion of time and identity, impaired time and depth perception, artificial sense of euphoria, distorted perception of the size and shape of objects, terrifying thoughts and feelings, fear of losing control, fear of death, and panic attacks. Many of these effects mimic schizophrenia symptoms. Previous studies on LSD that included schizophrenic patients resulted in worse clinical outcomes for the patient. Schizophrenic patients responded less to the same dose of LSD as a non-schizophrenic patient. Researchers then wondered if LSD could lead to a person developing schizophrenia. It was also found that consumption of LSD may lead to psychotic mania in users who have bipolar disorder or who are susceptible to it. Mania episodes can occur immediately or weeks after ingesting LSD. Early research attempted to treat bipolar depression with the use of LSD. However, it was found that LSD induced mania in all patients. The use of LSD can bring out and increase the severity of psychotic disorder symptoms in users susceptible to those disorders. Regardless of having a psychotic disorder, psychosis can occur in anyone who uses LSD, but some people may be at a higher risk. Symptoms of psychosis include a loss of contact with reality, hallucinations, delusions, paranoia, anxiety, depression, and insomnia. Psychosis is a symptom of schizophrenia and bipolar mania, and those who have these psychotic disorders are more likely to experience psychosis with the use of LSD than an individual who does not have these disorders. An individual with no history of psychotic disorders can develop psychosis by misuse, abuse, and withdrawal of LSD. Psychosis can last from days to years due to a change in brain chemistry. This drug-induced psychosis will improve without treatment after use of the drug is stopped, but may take weeks for chronic users. It's important to note that drug-induced schizophrenia is not the same as a schizophrenia diagnosis, as drug-induced schizophrenia occurs only during the period of using the drug. The use of cannabis, MDMA, and amphetamines can also result in drug-induced psychosis. So, how can we fix this issue? First off, the legal status of LSD, along with other psychedelics, needs to be changed so more research on LSD as a therapeutic can be conducted in order to learn more about its effects on users with mental health disorders. We must also spread the knowledge of what we already know. We know that psychedelics, such as LSD, can bring out schizophrenia and bipolar mania symptoms in users who are already susceptible to these disorders. However, more research needs to be performed on psychedelic use in children, as this may affect future psychotic diagnoses. We also know that LSD use does not cause a direct diagnosis of schizophrenia or bipolar disorder in the average user with no family history of mental disorders. Individuals with a family history of psychotic disorders are at a much greater risk of developing these symptoms, along with psychosis. Developing psychosis from LSD use can result from misuse and abuse, the environment, and trauma as well. Therefore, it is important to know the dosage of LSD being used and how it might affect you if you have underlying conditions with the information that we already know from previous research and history.